Welcome to Have More Babies. I'm Stella. Today we're diving into something huge, basically a guide through pregnancy and bringing home a newborn. We've got this great source material we looked at. Think of it like um, a friendly manual, really, packed with info, tips, aimed at new parents, or if you're thinking about becoming one.
Exactly, Stella. And it's such a life-changing time, isn't it? The source really hits on how pregnancy just shifts your whole perspective on, well, everything.
It really does.
And being prepared, having good information, that's so key for making it a healthy, happy experience.
Okay, so let's start unpacking it. The source breaks down pregnancy first. It's about 40 weeks, give or take, and they split it into 3 trimesters.
Right, the classic 3 stages. And each one's a bit different. First trimester, that's weeks 1 to 12, roughly. This is when all the major organs are forming.
Foundational stuff.
Absolutely. And for you, maybe morning sickness, feeling really tired. Mood swings are pretty common too.
Then the second trimester, weeks 13 to 27.
Yeah, that's often called the golden trimester. The source mentions many people feel their best then. Morning sickness might ease up. Energy levels could rise.
A bit of a break.
Kind of. And the baby's organs are maturing. Plus, you usually start feeling those first little flutters or kicks, which is
Well, it's
amazing.
definitely a milestone.
Then the third trimester, weeks 28 right up to 40. This is the home stretch. Baby's basically getting ready for delivery, growing fast, putting on weight.
Which means things get pretty crowded in there, I imagine.
Exactly. That can lead to things like shortness of breath, maybe more discomfort.
And it's not just about the baby's development. Your body is going through massive changes, too. The source talks about, weight gain, breast changes, your abdomen tightening,
All totally normal physical shifts.
and those lovely common discomforts. Morning sickness again, maybe fatigue comes back, constipation, heartburn. They're all part of the deal for many, according to the source.
They are.
Mm.
And, the emotional side is just as big. There's joy, excitement, anticipation. Absolutely. But the source is good about mentioning the fear and anxiety that can pop up too.
That's important to acknowledge.
Totally. And the key takeaway there is talk about it. Talk to your partner, friends, family, your doctor. Don't just bottle it up.
Okay, so given all that's going on, physically and emotionally, what are the big must-dos from this source for a healthy pregnancy?
Right. Actionable stuff. The source really emphasizes a few key areas. Number one, and they call it where it all starts, is nutrition.
Makes sense.
A balanced diet. Lots of fruits, vegetables, lean protein, whole grains, healthy fats. It's crucial because you're literally building another person and supporting yourself.
You need fuel for two.
Precisely. Then, staying active. They strongly recommend regular, low-impact exercise. Things like walking, swimming, prenatal yoga.
Nothing too strenuous, though.
No, it's not about high intensity. The source points out it actually helps make pregnancy more comfortable. It can reduce stress, boost your energy, help with weight management.
Okay, good to know. What else?
Rest. Getting enough sleep is huge. The source aims for 8-9 hours a night. Now, they're realistic. They know finding a comfy position gets harder later on.
I bet.
Yeah, so naps get the thumbs up. Catching up on rest whenever you can.
And then there are the things to avoid.
Oh, absolutely critical. The source is crystal clear here.
Yeah.
Zero alcohol, no drugs, no cigarettes, no vaping. Full stop. Avoid harmful substances completely.
Non-negotiable.
Completely. And finally, regular visits with your healthcare provider, your obstetrician or midwife. These appointments are vital for tracking your health and the baby's development all the way through.
All right, let's dive deeper into those trimesters. What specific feelings does the source mention, and what are the concrete do's and don'ts for each stage?
Okay, first trimester, weeks 1 to 12. Feeling-wise, expect fatigue, like real fatigue. The source says it's normal. Your body's doing huge work. So rest.
Permission to nap.
Absolutely.
Ah.
Morning sickness or just general nausea, very common. The tip is smaller, more frequent meals, maybe avoiding strong smells that trigger it. Breast tenderness, needing to pee more often, also on the list. Your uterus is growing and putting pressure on things.
So tired, maybe queasy, living near the bathroom. Got it.
Pretty much sums it up for some. Now, the big do's from the source. Start prenatal vitamins right away if you haven't already. Stay hydrated. Focus on that good nutrition we talked about. And crucially, get set up with an obstetrician or midwife. They're your main guide.
And the don'ts.
Still the big ones. No alcohol, vaping, smoking, or illicit drugs, period.
Okay, moving on. Second trimester, weeks 13 to 27. The golden one.
Often, yeah. You'll likely start showing more noticeably, feeling a bit heavier, maybe some water retention, and the really exciting part, feeling the baby move.
Ah, the kicks.
Exactly. The source highlights how amazing that is, but new discomforts can emerge too. Heartburn might kick in because of pressure from the growing fetus. Smaller meals can help there.
Makes sense.
Backaches are common too, just from the weight shift. Good posture, gentle stretches, maybe a support belt can make a difference. Some swelling in feet or ankles might start too.
And stretch marks.
Yeah, the source mentions those too. Using moisturizing creams or oils might help, though genetics plays a role. And you might start noticing Braxton Hicks contractions.
The practice ones.
That's right. The source describes them as your uterus kind of tuning up. Usually not painful like real labor, more like a tightening. Pay attention, maybe practice relaxation.
So the do's for this phase.
Keep up the good habits, keep exercising gently, stick with the healthy diet, and definitely don't miss your prenatal appointments. They're still tracking important developments.
And the don'ts remain the same.
Yes, the absolute restrictions on alcohol, smoking, vaping, drugs, those continue throughout the entire pregnancy.
Right. Okay, third trimester. Weeks 28 to 40. The final countdown. What's the vibe now, according to the source?
Definitely growing. Significant tummy growth. This can bring back fatigue just from carrying the extra weight. Shortness of breath is common because your uterus is pushing up towards your diaphragm.
So take breaks.
Definitely. Avoid overexertion. Sleep can become difficult too, just finding a comfortable position with a big belly. Pillows are your friend, warm baths, relaxation techniques.
Sounds challenging.
It can be. Braxton Hicks might become more frequent or noticeable. Staying hydrated and changing positions can sometimes use them. Increased vaginal discharge is also normal. Unless it's itchy or has a strong odor, then call your provider.
And emotionally. Getting close to the end.
Yeah, the source mentions anxiety or tension can increase as the delivery date nears. That constant heaviness is, a reminder.
So what's the most critical do now?
The source really hammers this home. Do not miss your clinic appointments. They're absolutely vital in these final weeks. They're checking the baby's growth, position, your blood pressure, everything. It's critical.
Okay, super important.
And keep an eye on the baby's movements. You get used to their pattern, so a significant change warrants a call to your provider. Just that peripheral awareness.
And the don'ts for the third trimester. Any new ones?
Besides the ongoing substance restrictions, the source advises against things like long trips, strenuous activities basically, nothing risky, no skydiving. And they even mention avoiding major fights or stress if possible.
Good advice anytime, probably.
True. But especially now.
Phew. Okay, that's the pregnancy journey. Now for the main event, labor and delivery. The source says this can feel overwhelming, right? Especially first time.
It definitely can be. It's the great unknown for many. But preparation really helps manage that feeling. The source has solid tips.
Like what?
Taking a childbirth education class is high on the list. Understanding the stages of labor, learning pain management options, whether it's breathing techniques or medical options.
Where do you find those?
Formal classes through hospitals or community centers. But the source also mentions reliable online resources. Think CDC, ACOG websites, reputable health organizations, even blogs or YouTube channels if they're credible.
Good. What else helps prepare?
Creating a birth plan. It's basically a document outlining your preferences. Things like who you want in the room, pain relief choices, delivery positions, immediate baby care.
So you can think about it beforehand.
Exactly. It helps you communicate your wishes to the hospital staff and your provider. And, of course, packing that hospital bag.
The classic advice.
Yes. But the source adds a nice touch. Don't underpack. Bring essentials, sure, but also things for comfort. Your own pillow, music, a tablet, snacks, things to make it feel a bit more like home during potentially long waits.
Smart.
They also really push practicing relaxation techniques before labor starts. Breathing exercises, meditation, visualization, pregnancy and delivery are stressful. Having tools ready to help manage tension is invaluable.
Makes sense to practice when you're calm.
Totally. And the number one tip, repeated throughout the source regarding labor. Talk to your obstetrician or midwife. They have a little phrase. When in doubt, obs it out.
I like that.
They are your best resource. They're trained for this. They know your history. Use your clinical team midwife, OB, nurse practitioner, doula, whoever's on your team.
Okay, so the baby arrives. Huge moment. But the journey isn't quite over. Recovery is next, and the source stresses how important that is.
Absolutely. Labor is a major physical event. Your body needs time and care to repair and recover. Postpartum care is crucial.
What are the key postpartum tips from the source?
Number one, rest. Seriously. It sounds simple, but it's hard with a newborn. The advice is map when the baby naps. Be kind to yourself. Ease back into things. Let your body heal.
And keep eating well.
Yes, continue that nutritious diet. It's important for your own recovery, energy levels, and especially vital if you're breastfeeding. Keep up the lean protein, whole grains, fruits, veggies. Avoid junk. Sort of stay in that same healthy lane.
Got it.
They also highlight Kegel exercises. The source calls them the best pregnancy exercise for new moms. They strengthen those pelvic floor muscles, which helps with recovery, bladder control, all sorts of things after birth.
Where do you learn those?
You can ask your provider, find tutorials online from reputable sources. Sometimes physical therapists or even mommy groups can help ensure you're doing them right. You can do them anywhere, anytime, once you know how.
Okay. And checkups continue.
Definitely. Attend your postpartum checkups. Usually around 6 weeks, but maybe sooner, depending on your delivery. Your provider needs to check that you're healing properly, physically and emotionally. Don't skip these.
Especially important if the delivery was complicated, I guess.
Yes, or if you had tearing or a C-section. But important for everyone. And the last big postpartum point is seeking support.
For mental health.
Exactly. Postpartum depression is real and surprisingly common. The source notes it can affect up to 7% of moms even a year after birth. Talk to people, your partner, family, friends, and definitely tell your healthcare provider if you're struggling. There's help available.
So important. Now, once the baby is here, the focus shifts to their health too, right? Pediatrician time.
Immediately, yes.
Yeah.
The source strongly recommends getting your newborn established with a pediatrician very quickly. They suggest seeing the pediatrician within just 1 or 2 days of coming home from the hospital. For that first checkup, weight check, feeding assessment.
Wow, that's fast.
It is, but those first few days are key. The source even has a great suggestion. Consider doing a meet and greet with potential pediatricians before the baby is born.
Oh, interesting. To find a good fit.
Exactly. To find an office and a doctor you feel comfortable with, establish that relationship early. It's one less thing to worry about after the baby arrives.
This has been incredibly thorough. We've walked through the whole timeline, pregnancy, birth, postpartum, newborn care, all based on this really practical source material.
And just to be specific, the source material we've been drawing from is from Omega Pediatrics. They're located in Roswell, Georgia.
Right, and the source mentioned they serve families in nearby areas too, like Alpharetta, Cumming, Sandy Springs, Johns Creek.
Yes, and they provide a whole range of services. Newborn care, like circumcisions, lactation support, regular checkups, after-hours care, immunizations, even things like obesity medicine and medical ear piercings.
The source really emphasizes their approach, trying to make care accessible and treating families like, well, family. Apparently, people travel quite a distance to see them.
Up to 90 minutes, the source mentioned, which says something.
So if you want to dig deeper into any of the details on trimesters, preparing for labor, postpartum tips, finding pediatric care, the information comes from them.
That's the place to go. For more details related to everything we've discussed about pregnancy and newborn care, visit omegapediatrics.com.
That's omegapediatrics.com. omegapediatrics.com. All the info we discussed is rooted there.
You know, thinking about all these stages we've covered, the rapid changes, the intensity of birth, the recovery, it's such a concentrated period of transformation.
It really is. Almost overwhelming when you lay it all out.
Right. And this guide helps break it down, which is great. But here's a thought to maybe leave you with. This entire intense journey, from conception through postpartum recovery, it's really just the starting line, isn't it?
How so?
Well, it's the beginning of the much, much longer journey of parenthood itself. That transformation continues, just in different ways, long after the physical recovery is done. This huge biological event launches you into decades of growth and change as a parent.
That's a really interesting perspective. It doesn't end after the 4th trimester.
Not at all, it just shifts gears.
Well, thank you for joining us today as we explored all this incredibly useful information. We hope it felt helpful.
Yes, keep learning, keep asking questions. It's an amazing journey.
We'll be back soon with another exploration.
Goodbye for now.
And don't forget, for more information on today's topic, check out omegapediatrics.com. Goodbye.